During the COVID-19 pandemic, 20% of students have reported that their mental health is declining rapidly. We are currently experiencing outside stressors to include climate change, social unrest, political turmoil on our new normal. Although we return back to our normal lives, it is still evident that we are still processing some of the various stressors. Now more than ever, it is important that as future physicians, we gain the skills necessary to advocate for our own mental well-being and the mental well-being of our future patients.
There are many stigmas surrounding the topic of mental health, and it can be a really personal subject to speak about. These factors can make it hard for individuals to reach out, creating barriers to accessing quality healthcare. With this in mind, we as future physicians and healthcare workers must put in the work to address our own biases and behaviors that may be contributing to the stigmatization of mental health.
For these reasons, MAPS is hosting a pre-health conference titled Self-Care and Healthcare, Destigmatizing Mental Health in the Medical Profession. This conference aims to start a conversation about mental health struggles students are facing and also equip them with the tools they need to promote wellness and also manage stress and anxiety as future physicians. In doing so, we hope to support the overall SNMA and MAPS goal of addressing the needs of underserved communities and increasing the number of clinically excellent, culturally competent, and socially conscious physicians.
The event will be held January 22nd, Saturday at 9:30 a.m. to 4 o'clock p.m. via a virtual platform called Hopin.
We will have medical student and physician panels, MMIs, professional development workshops, and various resources to promote mental well-being. Registration is now available and all are welcome because medicine needs you.